Hello again. This time I'm back to help answer some questions that you all may have. The first question I have on my agenda is, should we be worried about COVID-19? Well, as I mentioned earlier, COVID-19 is a novel virus. It's still very new to us. It's a different strand from SARS. It's a lot that we still need to learn about this virus. Um, I would never tell no one to not be cautious or not be worried about a virus. You always want to take precautionary measures to ensure your safety and also the safety of others or loved ones. So therefore, I wouldn't say not to be cautious or worried about it, but just take precautionary measures, as we mentioned earlier, um, social distancing, maintaining proper hygienes, things of that matter. The next question we have is, what is the method to containing the spread of the virus in Florida? So social distancing is obviously one of them, a big one. You want to maintain 6 feet distance from one another, because if someone coughs or sneezes, the aerosol droplets are able to travel about 6 feet or more. So always try to maintain that distance between one another. Where with this, we're working very close with the CDC and the NIH, and these individuals, I have seen them, working. They know what they're doing, and they're working very hard on finding solutions to combating this virus. So some of the methods is social distancing, maintaining proper hygienes, always washing your hands, drying them off properly, and make sure you wear your mask. When you go out in public, wear your mask, not only because you don't know who's sick around you, but it's also a barrier between your respiratory system. You want to prevent as much transmission as possible. This is very important that we follow these guidelines provided by the CDC, because it has been shown to help slow down the spread of the virus. The next question we have here on the agenda is, are there any vaccines or other medical products to help prevent COVID-19? So, as I mentioned, we're working very close with the researchers. They're working very hard, and other manufacturers are working very hard also to all try to come up with a vaccine or some type of medical solution. So far, we have come very close to finding certain vaccines, but now we're in the phase process. So we have completed phase 1 and working towards phase 2 to see if there would be any later complications. We never want to just jump out and give somebody a solution. We want to make sure we put contingency plans in place, just to make sure we know what's going to happen and think about the possible outcomes of this virus, or the product that is being put into someone's system. So right now we're working on different phases and seeing what possible complications that can arise from this product, and if it's even worth it or safe for the individual to consume. Okay, the next question I have on my agenda is, how soon will COVID-19 testing sites become available to everyone? Right now, we're working with the City of Miami Police Department. We're working with many departments, police departments, fire departments, to try to put together testing stations at different parks, open lots, convention centers. We're opening up areas which has large capacities, so we can help maintain the 6 feet distance and allow all individuals to be able to get tested safely and quickly. That is our main objective, to make sure that it is affordable to everyone, Make sure that it's in a nice geographical area where, you know, everyone is able to gain access to these testing sites. So we're working very hard right now to open up as much testing sites. We're trying to open up at least 2 to 3 testing sites every week to make sure that everyone is able to get out there and get tested. And we want to do this safely. Okay? Is there any more questions? All right, so there's no more questions on the agenda. I would like to say thank you all again for this briefing, and I hope you all have a wonderful evening. Goodbye.